I am Dr. Sohag Bose. I am a consultant neurosurgeon in Asansol, West Bengal. I am going to talk about epilepsy today. So, epilepsy, as we know, is a age-old disease. It has been written about in all the old scriptures. This disease is related to. It has been related. It has a social stigma attached to it. People fear it till date. As we know that this disease is not contagious, it doesn't spread actually. So by touch or by droplet infection, this doesn't spread. This message has to go into the society. So what is epilepsy? Epilepsy is a disorder in which there is a constant abnormal electrical discharges from the brain, and this can be generally of two types. It can be a generalized epilepsy or it can be a partial epilepsy. So, what is important is a diagnosis of epilepsy, because thereafter, whatever follows depends upon the type of the epilepsy. So, what are the important things? The important things are, after diagnosis, the patient has to take the medications regularly and at a proper time. If the patient misses a dose, suppose in the morning, he should take the dose the moment the patient knows about it. He should not miss a single dose, because a fit can come in between the doses actually. So there are a few triggers we have seen, like a lack of sleep, stress, strain, maybe very powerful odors like maybe caffeine or a particular fragrance, which can trigger epilepsy actually. So a patient usually knows the triggers. So they have to avoid the triggers actually. And epilepsy, as we know, the patients have to take medications for a long period, maybe, sometimes years or sometimes a whole lifetime. So there are medications which have very fixed side effects. Phenytoin has its side effects. We have seen levetiracetam has its side effects. Carbamazepine has very severe side effects if taken during pregnancy. Valproic acid in children and pregnant women are contraindicated, particularly in pregnant women. So these are very clear-cut, side effects which have to be taken to account. And then, if we see that there are particular subgroups like pregnant women who have to be very careful, and the pregnancy can be normal pregnancy if the drugs are chosen very judiciously. So, what are the precautions a person has to take? The person has to take a clearance from the treating neurologist about driving, whether the patient can drive alone or the patient needs somebody besides him or her while driving. So this is very important. Children also, all medications cannot be given to children. So this has to, so basically the medications have to be under supervision, taken under supervision, and regular follow-up is required. At the end, I would say that epilepsy, we have reached an era where a clear-cut diagnosis can be made of the type of epilepsy. There are drugs, very good drugs, safe drugs, which can be taken for a long time, and patients should understand the person-specific triggers, which are very important, and to try to avoid the triggers. And if there are any side effects of the medications, they should talk to the treating doctors, so that the medication can be changed, and in the specific subgroups of patients, special precautions have to be taken. Thank you.